You've ever feel like no matter what you do, your energy levels, digestion or sleep just aren't where they should be? You're not imagining it, and there is a solution. In this episode, we sit down with medical doctor Dr. Saurabh Sethi, an expert in gut health and internal medicine, to reveal the often overlooked connections between your gut, mind, and overall well being. From practical meditation tips to improving your gut health and sleep quality, this conversation is filled with valuable knowledge that can help you take control of your health. If you're ready for real change, stick around. You're about to discover the key to a healthier you. Thank you for watching so many of my episodes. But before we begin, please like, subscribe, or share this channel of mine with your loved ones. We aim to reach people across the world and change their health for the better. By you sharing, liking, or subscribing allows me and my hard-working dedicated team to push content to you that's life-changing and also very valuable. Thank you so much for all that you do for us. I look forward to seeing you at the end of this episode too. Hey, it's an absolute honor to be with you here today, Dr. Saurabh. And, um, you're in the Bay Area, which is on the other side of the world. But technology has allowed us to come together and talk about what 1.4 billion Indians really need. Now, whilst you may be practicing in the USA, you are a doctor, you have Indian roots, you eat dal chawal roti. Am I right?
Absolutely right.
So I watched your Instagram. You're famous. You give trusted tips. You practice in a clinical setup. You are a doctor. You don't need to influence people. You are a person who gives the correct medical advice. So before we get into all of these health concerns and all, I want to start something basic, which has got nothing to do with the medicine part, but you've been a big advocate of meditation. So my first question to you is, how does this suddenly fit into a doctor's approach? And what has been your observations or research or studying on your patients or you in where the meditation has an impact on physical well-being?
Sure, Ryan. First of all, thank you for having me, and I've been looking forward to this. So, with that said, I love meditation. In fact, I like to do it for 10 to 15 minutes in the morning, almost daily in my closet. It's a quiet, dark room. No one bothers me there. And I found that perfect spot, 5 to 10 minutes or 10 to 15, whenever I have time, I practice meditation. I recall a saying, you should meditate for 10 minutes a day, but if you are really busy, you should meditate for 20. The idea is that the
Oh,
busier you are, the
okay.
more meditation you need. We live in an overstimulating society. Our cortisol levels are high most of the times. Because of that, there is a lot of stress that we undergo on a daily basis. And that is where the meditation comes into play. Meditation activates the parasympathetic system, the rest and digest mode. It lowers cortisol levels.
Doctor, I have a question for the lay person. What is this parasympathetic nervous system? I keep hearing about it, parasympathetic, parasympathetic. And I think it's a sympathetic nervous system. Now, sympathy, you should give something. So, for all of us non-medical people, what is this parasympathetic nervous system?
Sure. So the parasympathetic system is the rest and digest mode that our body has. It basically balances out the sympathetic system. It lowers the cortisol levels, which in turn can reduce the risk of chronic conditions like hypertension, metabolic syndrome, heart disease, and even depression. In this day and age that we live in, meditation is an absolute essential.
And I have recently, after watching few of your Instagram posts about 6 months ago, there was this part I went to a meditation coach, and I told the meditation coach, I can't meditate. Like I sit down to meditate and I'm thinking about gut health. I'm thinking about some client who walked in and he had to go on to dialysis. So I'm trying to balance out the potassium, sodium. So my mind's constantly wandering. So can I just do meditation with just breathing and music?
Absolutely. I mean, that's how I practice meditation as well. Just sit in a dark, quiet room, or, a little bit of soft music for 10 to 15 minutes. Choose a time where, what works in your schedule. And there's no rocket science to meditation. Just start, 10 to 15 minutes, quiet room, light music, and you'll start seeing the difference in your anxiety levels, in a few weeks.
Awesome. Uh, Practical advice, Dr. Saurabh. Thank you so much for that. I'm going to start doing that today, but definitely not going to do it to Coldplay music. I'll find some 432 hertz music to kind of just sit down over there and do some deep breathing. Now, from breath work, which is the lungs, and you talked about the parasympathetic, which is the internal digestive systems and the movement and metabolism and all. I want to come to the lower part, which is the gut. Okay. And you being a gut expert, there's a big focus today on gut health. In fact, to be honest, as a confession to you, as a nutritionist, we always looked at blood test, right? But we never thought about that the food can really affect the gut. Now, we are hearing as nutritionists and as general public that everything is connected to the gut, the mind gut connection and all. So first things for all our listeners out there, from a doctor's perspective, I'd like you to explain to them what is the gut and how is it connected to our health.
Sure. The gut includes the mouth, esophagus, stomach, small and large intestines. It also consists of gut microbiome, which is made up of trillions of microbes that play a key role in our overall health, all the way from digestion to mood.
Awesome. And when we say it's connected to digestion, that I can understand. Oh, okay. There's a bacteria. The bacteria will eat the food, and then he'll have some enzymes, or he'll create some bad molecules if it's a bad bacteria, and good molecules if it's a good bacteria. How does that affect our heart health? How does it affect our moods? Is this something that you have started seeing as a doctor because we eat all the wrong foods?
Yes, indeed. So, first of all, let me ask you this question, Ryan. Have you ever had a gut feeling about something, like something good or bad is going to happen?
Yeah, actually, a lot of the times I listen to my gut sometimes like I don't want to go, I don't want to go to that party, or I don't want to meet this person, or if I get an email, my gut feeling says don't answer it right now.
Yep. So, and this is because our gut is our second brain. There is a very strong gut brain connection that we are aware of. Secondly, around 70% of the immune system is located in the gut, which impacts our immune health. And then there is gut skin connection, gut lung connection, gut liver connection. We as scientists are continuously discovering more about these connections, and it is absolutely fascinating.
Was there any one case that came across in your medical career recently or in the recent past that shocked you even from the link between the gut and that organ of the body?
Yes, of course. So last week I saw a patient with chronic bloating, change in bowel habits, and fatigue, and some skin issues. So I did a thorough workup. I did an endoscopy, colonoscopy, some imaging studies, blood tests, and ruled out conditions like inflammatory bowel disease, ulcerative colitis, Crohn's disease, celiac disease, and H. pylori infection. All of those was ruled out. So as
So
it
when you
turns
say
out,
ruled out, you couldn't find it.
yeah, so all of those things ruled out. And as it turns out, her poor diet coupled with stress had triggered a severe case of IBS, that is irritable bowel syndrome. So what I did was I started her on a low FODMAP diet, and within a few weeks, her symptoms were greatly improved.
Awesome. So I think what I'm hearing from you, Dr. Saurabh, is that you're living in America, a very advanced nation, a very affluent nation, but even there, people have stress and wrong diet. And people think that they get this gut disease. So you, as a gut doctor, go to and analyze all the possible gut diseases, and then you suddenly realize that some of the starting points of these diseases may not be genetic, but our lifestyle, which is how they are eating. So, if that's the case, if it's lifestyle, uh, let's talk to all our listeners and all our fans and followers. Okay, what are some of the poor symptoms of gut health that we should be looking for?
Absolutely. So some of these are pretty obvious, right? The digestive issues like bloating, gas, diarrhea, or constipation. And then there are mental health issues like anxiety, depression, or brain fog because of this strong gut brain connection that we just talked about. Then there is fatigue, weight issues, skin problems like acne or eczema. These can all be signs of poor gut health.
Awesome. And when it comes to the diet, are there any certain foods or drinks that you would recommend for people to do to support gut health or improve it? And on the same breath, who are the gundas? Who are the bad guys in terms of your diet or beverages or what people do?
Absolutely. So there are three things that you can do to improve your gut health. The first one is including more probiotic foods, and these probiotic foods means these are the actual beneficial bacteria for our guts, and you get these from fermented foods like dahi, yogurt, buttermilk, kefir, and kombucha. Secondly, eat more prebiotic foods. Now, these prebiotics are the food for the gut bacteria. So, these are foods like leeks, onions, garlic, and asparagus. Thirdly, um, drink plenty of water. So, a general rule of thumb is drinking 8 glasses of water daily. That will keep your gut health in balance.
Awesome. And what are the gundas that are affecting people today?
Absolutely. So, first and foremost, the ultra processed foods and sugar. These basically mess up our gut microbiome by promoting the bad bacteria. So we need to stay away from those as much as possible. I know it is virtually impossible to stay away from these completely, but just try to minimize as much as possible. Second would be soft drinks.
Soft drinks.
Yeah, soft drinks, and I mean both regular and diet soft drinks. So regular ones, no brainer, right? They're full of sugar, and sugar is very harmful for our gut microbiome. But even these diet soft drinks, they have artificial sweeteners like aspartame. And in my clinical practice, in my experience, that messes up our delicate gut microbiome. So I advise my patients and also the social media audience to stay away from both the regular and the diet soft drinks, and instead choose coffee, black tea, green tea, water, sparkling water, coconut water as their go-to beverages.
I think this is valid advice, doctor, because even when people come into my co-nutrition clinics for the diet part, and I tell them avoid ultra processed. Sometimes I have to tell them even going out, which is a lot of the techie guys, okay? So they eat Monday to Friday outside because obviously they're bachelors, most of
Yeah.
them up till the age of 30. And even if they're not bachelors, there's no time to eat breakfast at home, so they'll come to the office, they'll order food from outside. Now, you and I both know that a lot of the restaurant food is highly processed,
Yep.
may not be organic or the best quality. And
Mm-hmm.
then when you order from outside, you want to get these beverages that
Sure.
are with extra sugar in it. Now,
Mm-hmm.
at home, if I come to your house, Dr. Sethi, you will give me lassi, but you will be, Arey yaar, nutritionist has come, we'll put only 1 teaspoon of sugar.
Mm-hmm.
But if your friend comes, maybe you want to give meeta lassi, you'll give 2 teaspoons of sugar. Nobody goes beyond 2 teaspoons of sugar, right?
Yep.
But when we go to these restaurants, they put 6 teaspoons or 7 teaspoons of sugar just to make it wow and attractive. So I think you've pointed out some key components, which is ultra processed should be avoided, aerated beverages. And what's your take on also in today's world, people are overeating or eating too much?
Yeah, that's a big problem, right? And I think the main reason for that is not being satiated, right? Our stomachs are
What is the
not
meaning of
filled.
satiated, doctor?
Yeah, so we're not satiated, as in we are always hungry. And the reason is three things: lack of high quality protein, lack of fiber, and lack of healthy fats. So protein from, good protein sources like chicken, turkey, eggs, fish. If you're vegan or vegetarian, then chickpeas, legumes, lentils, tofu, paneer, these are excellent sources of high quality protein. So we need to increase those in our diet. Second would be healthy oils. You know, avocado oil, extra virgin olive oil, and moderate amounts of coconut oil and ghee. These are all healthy sources of, well, good sources of healthy fats. And then we're talking about fiber. So at least 5 servings of fruits and veggies. So if we focus on these three things, they're going to keep us satiated, and we are very less likely to go for that bag of chips in the middle of the night when the hunger pangs strike.
You know, that's very key. You satiate yourself properly, choose the right foods. You said the protein, the fiber, and the good fats. And you know, doctor, I want to make an honest confession to you. I've been running my nutrition clinic now for almost 14 years, and we're a massive team. And every time people come to us, they are like, "भाई बोलो दाल चावल रोटी कैसा लेने का है?" And sometimes I used to get confused, like, we want the medical cholesterol cases or the gut cases to come to us, but normal people come to us saying, Bhai, bolo dal chawal roti kaisa lene ka hai? And I think, Dr. Saurabh, one of the major responsibilities of people like you, the doctors, is to inform clients that they are eating out of love and culture, but
Yep.
not science.
Sure.
And today you're bringing science to the story, which is eat protein, eat fiber, drink 8 glasses of water, the essential fats. But you know something? We also need to make our fans and followers learn more about nutrition for their body. Because when you are educated, you make more informed decisions.
Yeah, knowledge is power. No question about that. No question about that.
When you say knowledge is power, today a lot of us have got a lot of knowledge. Like we're constantly bombarded by the internet. Like people must be watching our podcast right now. They might be doing it late night. And if you're doing this late night right now, everyone switch off this podcast. Come back tomorrow morning because this content is there forever for you to watch. So I want to shift to, you mentioned diet aspect for the gut health. But let's talk about this thing where people are being distracted by content. Sleep, doctor. People are sleeping less and less. I mean, I was almost sucked in by Netflix last night as I watched a serial. And I was like, yeah, it's so riveting. I want to come back and watch it. And I said, no, no, Ryan, watch it tomorrow on the weekend. So, doctor, in your clinical practice, because you are a clinician, you are not an influencer, you meet people. What is the number of people coming in where you have just snapped your fingers and said you need to sleep more? And what's the relationship between sleep and gut?
Ryan, I'll tell you this. Sleep is one of my favorite topics to discuss. I think it is the most underrated lifestyle modification out there, right? We talk about diet, we talk about exercise, we talk about meditation, but very few people are actually focusing on talking about sleep because it is not cool, right? But when my patients come to me and looking to start their wellness journey, I tell them start by fixing your sleep hygiene. Right, you need to have high quality 7 to 9 hours of sleep every night.
Hang on. Say that again for us, doctor. You need to have.
We need to have 7 to 9 hours of high quality deep sleep every night, and preferably if you can sleep before midnight, nothing like it, because that way you're going to maintain your circadian rhythm.
Doctor, are there any things as a, in the olden days, if you didn't have sleep, you'd go to a doctor and say, Doctor, give me a sleeping pill. But you're the modern generation doctor. You know that people can get sleep hygiene by first of all switching off their devices, writing a diary, journaling, do a little bit of meditation or Yog Nidra app that they can do. But is there anything that you write to, in general, that I can walk into a supermarket tomorrow and say that, okay, let me try and improve my diet. It's going to affect my sleep. Are there any recommendations like that you believe as a doctor should be given
Absolutely.
to people?
Great question, Ryan. So, first of all, I believe in blackout curtains, right? So, when we're trying to
What's that?
sleep,
I've never heard of it,
yeah,
doctor. I've
blackout
never heard
curtains,
of it.
right? I mean, we don't need to have any light in the room, in your bedroom when you're trying to sleep. Blackout curtains, absolutely. Please invest in that. Your brain is gonna thank you. Second, a white noise machine. It is also an essential if you're basically trying to sleep in a room where there is a lot of disturbances coming out, coming from outside. So white noise machine and blackout curtains. The third thing would be milk products. If you consume those during the evening time, they have an amino acid called tryptophan, and that can also induce sleep. So these three things are my favorite when I'm talking about sleep solutions with my patients and with my audience.
Awesome. And since I'm a nutritionist, Doc, I want to share this with your followers also. Research has shown that walnuts contain one of the highest amounts of picomelatonin. So yeah, I always prescribe walnut in the evening session for my clients. And research has also shown that chamomile tea gives a little bit of a deeper sine wave sleep. So all my Olympic level athletes this time at Paris, I was like, "Did you have your chamomile tea? Did you have your chamomile tea?" Having said this, I
I
see
would
that
I would
a
also
lot
like
of
to add a couple more things, Ryan. Now that we're talking about sleep, it's also very important what time you drink your coffee and tea, right? Because of the half life of these beverages, it's important to drink coffee at least 6 to 7 hours before your bedtime, and for the tea, it is 3 to 4 hours.
Absolutely, absolutely. And Doc, you hit the nail on the head because a lot of people are still working today at 5:36 in the evening, and that's the time of the day when your energy is the lowest, but you
Hmm.
still need to push through before you leave at 7 o'clock because people have deadlines today and they make that colossal mistake of picking up that cup of coffee. So I always say after 2 p.m., no coffee in your life. And tea, your last cup of tea should be no later than 5:36 in the evening. But there's also one aspect that a lot of people who work out don't get good sleep. And one of the key culprits, Dr. Saurabh, is branch chain amino acids. So when you take an intra workout or a pre workout post 5 o'clock in the evening, these have high contents of BCA structurally created in them of 5 grams. Now, that BCA is going to be roaming around in your blood. And, doctor, you know this, the tryptophan serotonin pathway and the Sandman hormone,
Hmm.
which can be deactivated by having high BCA, which promotes greater mental alertness.
Yep, you're right.
Dr. Sethi, when my kids study for exam, I don't make them drink tea or coffee. I give them branchy and amino acids. So the perspective over here is that these stimulants, the gym stimulants or the office stimulants, which is coffee or tea, you're absolutely bang on. We should try and tell people, please stop having it 2 o'clock for coffee, 6 o'clock in the evening. Now, people say, where did you get the research for 2 o'clock? You
Hmm.
know what? I believe on the internet, when you give people specific numbers, a
Hmm.
habit is created.
Exactly.
And I love the fact that you said sleep hygiene. I was just interviewing a sleep doctor the other day, and he says the problem is not waking up with the 7 to 9 hours of sleep. The problem is going to bed on time every day.
Absolutely.
So, what's your opinion on that? Trying to set the time. What do you feel? Before we dive back into our conversation with Dr. Sethi, I know you're wondering, why am I walking right now? Well, staying active is a key part of my keeping my biological age lower than my birth certificate or chronological age. So I move whenever I can, during podcasts, counseling sessions, or whenever I feel like it. And what am I walking on? It's the Jog Pad 5 by Powermax. It's lightweight, easy to store, and I can set it up in just 5 minutes. If you want one too, check out the link in the description for an exclusive Ryan Fernando discount. Now back to Dr. Sethi.
Any good habits take time, right? um, as a dad of two boys, they're 10 and 9. I know it's a struggle to put them to bed every single night, around 9 p.m. But um, you know nothing good in life comes without hard work, I guess. We have to pay our
Yeah,
dues. We have to pay
And
our
I think
bills.
that's a very good thing, the
Yeah.
habit that you're doing. My son also, he's 11 years old. He has to he has to start unwinding at 9, and he has to be in his bed at 9 o'clock.
Hmm.
And there's one thing, we don't allow him to have a holiday for sleep.
Yeah, sleep is sacred for us, right? Every night, 9 or latest by 9:30, they got to be in bed. I think it's a habit that's gonna serve them really well when they grow up.
Yeah, my son was asking me, Papa, till what age do I have to be in bed by 9:30? I said, till you're 65 years of age, you have to be going to bed at 9:30 in the night. He's like,
Well, you're lenient. I tell them 90 years.
his comeback was, okay, so when I'm 66 years old, I can go out partying. I was like, yeah, yeah, you can go
Yeah.
out partying at 66 years of age. But jokes apart, um, you're a doctor, you're a serious medical doctor, and you do come in. You've studied in India from one of the most prestigious institutes over here. Um, do you take flavor from our old Indian natural remedies? Have you practiced in gut health with things like cumin, fennel, turmeric, ginger, clove, cinnamon, like our Indian spices? Basically, it sounds like a biryani. But
I
do
love
you
biryany, by the way.
advocate
Yeah.
any of who doesn't?
Yeah.
You can take it. You can take a man out of India, but you can't take the biryani out of
Yeah.
an Indian
There you
man.
go.
No.
Absolutely right.
So coming back to foods, are there any ancient Indian spices or herbs that are your favorite?
Yes, as I said earlier, I love consuming herbs and spices in my food. Not only are they delicious, but they're also full of polyphenols and antioxidants. And three of my favorite herbs and spices are: first one, turmeric, right? It has an active compound called curcumin, which has antioxidant and anti-inflammatory properties. I love consuming it in my yogurt or dahi, almost on a daily basis. Second would be fennel seeds, and I'm talking about unsweetened fennel seeds. They ease bloating and gas after meals, so I usually consume those after every dinner. And then third would be ginger. It has a compound called gingerol, which promotes digestion and prevents nausea. And it goes in my evening tea almost on a daily basis.
When you practice as a doctor, do people ask you, डॉक्टर मैं क्या खा सकता हूँ, क्या ये ले सकता हूँ, वो नहीं ले सकता है? So what do you do in such perspectives when people are confused about how much to take or what to take or which quantity or timing to take?
It just needs a thorough discussion because every person is different, right? Everyone's gut health is different. So we just need to discuss their comorbidities, as in the other medical problems they have, or the medication that they're on, or their family history, all of those things, and what their goals are. And then we come up with a personalized plan for them.
Awesome. I'm also assuming that a lot of people come in with heavy issues, meaning their weights are heavy. So, are you seeing any correlationship between fixing the gut or solving gut issues and the unexpected weight gain or the obesity that we see in people?
Yes, of course. So we know that a balanced gut microbiome can improve metabolic rate and help in weight management. In fact, in a study published in Nature in 2013, researchers transplanted gut microbiome from lean mice into obese mice. The treated obese mice lost significant weight and improved insulin sensitivity. That just shows how significant our gut microbiome health is for managing our weight problems.
Wow, that's an amazing fact.
It
So
is
you're
fascinating.
saying that the skinny mice made the fatty mice skinnier.
Exactly. You heard it right. Much,
Let's
yeah.
shift gears. Let's shift gears to another topic that's becoming increasingly important, liver health. We know that fatty liver is on the rise. About 38.6% is what statistics show. And what's going on here with this liver issue and what can we do, doctor?
Yeah, wow, it's a big number. So as you know, I did my medical school at AIMS in New Delhi, India, And during my time there, what I noted was I saw a lot of patients with fatty liver. And I was shocked to learn that most of them were actually teetotalers. And on top of that, mostly were neither overweight nor obese. So, Ryan, have you heard of a term called skinny fat?
Yes, yeah. So people who are skinny actually are fat inside.
Exactly. So, as it turns out, these people fit in the category of being skinny fat. They had a high body fat percentage and low muscle mass. And this is not an uncommon scenario in India, as our diet can be carb heavy and low in protein. So we do need to spread awareness about this particular phenomenon. Secondly, screening and early detection is key to early intervention and better management. Anybody who is overweight or has diabetes, cholesterol issues, or signs like jaundice, itching of the skin, or very dark urine need to get their liver evaluated with blood tests at the very least, and possibly an ultrasound and elastography as well.
Do children get affected by fatty liver? Is it becoming a concern for younger populations?
Absolutely, indeed, and it is awful. I have two kids, as I mentioned, so I always try to make sure that they are staying active and not rotting away like couch potatoes on the sofa with an iPad all day long. Yes, right? So, this is a very important topic for me as a dad. And there are two reasons why this is happening. First, our kids these days are eating way too much fast food. They're drinking way too many soft drinks. They're relying on sugary cereals first thing in the morning, and these cereals are nothing but serial killers. Secondly, our kids are having excessive screen time and very little outdoor play time, and this contributes to obesity and insulin resistance, which are risk factors for fatty liver disease in kids.
But doctor, when we talk about this liver, there is a lot of things on the internet about supplements. And for people listening in, they're like, okay, should we take a liver supplement? Or is this just a marketing trend that's happening?
Here is my take on the trending liver supplements, that you keep hearing about on TikTok, Instagram, etc., etc. Most of these are complete junk. However, there are two supplements that you may consider if you're looking to improve your liver health after discussing with your own doctor. First would be milk thistle. It contains silymarin, which has antioxidant properties that can protect the liver cells from damage. And second would be turmeric, which has an active compound called curcumin. It has anti-inflammatory properties that can benefit liver health. It is very important for me to mention that as a liver specialist, I have seen a few cases of liver failure from improper use of these supplements. So make sure to talk to your doctor and check the proper dosage for these, and make sure that there is no interaction with the medication that you're already on before you try these out.
Well, it's amazing that you've taken time out of your busy day and all. I know you've had a tough day at surgery and all. I'm going to ask you last few questions are there. Nobody talks much about men's fertility, and the health of men's basically reproductive health. Are you seeing a relationship as a medical doctor between falling fertility rates, libido, and stuff like that?
Great question, Ryan. So, in regards to men's fertility, first I would like to mention a couple important studies to put this in perspective. A meta analysis published in 2017 found that sperm counts among men in the Western countries has declined by more than 50% from 1970s to 2011. And guess what? Another study published an year later found similar trends in urban Indian men as well, suggesting that this trend is worldwide. And here are the top four reasons I believe this is happening. First and foremost, smoking. It is a no brainer. Smoking is bad in every sense of the word. We know about its bad effects on the lungs and heart, but it also reduces sperm count, motility, and increases DNA fragmentation in sperm, leading to lower fertility levels. Secondly, regular alcohol consumption can also reduce testosterone levels, decreasing the sperm quality. Thirdly, a diet rich in ultra processed food has been linked to lower sperm quality and motility as well. Yep. And finally, Exposure to chemicals, for example, BPA in plastics and pesticides, has been linked to reduced sperm quality as well.
Awesome. Doctor, those are really great points. And I think that's all of us Indian men in urban India are getting exposed to a lot of these things. Somebody might joke and say, yeah, but we are the largest population in the world, but the fertility rates are actually declining. So we've got you as a practicing liver specialist doctor advising clients on gut health also. You must be seeing a lot of patients every day. If you had to meditate and give us what are the by looking at all of these people who have done some bad stuff and they've hurt their body and you're repairing their body. So you're like, okay, I'm going to be the Wizard of Oz and try and reverse this on the population of the earth. In your experience, what are the top five lifestyle practices that you would recommend for your overall patient's health?
So, first and foremost, focus on high protein and high fiber diet. This will keep you satiated and you are less likely to have hunger pangs and go for that bag of chips in the middle of the night. Second off, switch your beverages. Ditch the soft drinks, and I mean regular and diet. Consider other beverages like water, sparkling water, black tea, green tea, coffee, coconut water is fine as well. Thirdly, it's a cliche but still worth mentioning. Regular exercise is very important. Aim to include 30 minutes of moderate intensity exercise daily. And if you don't have any lung or heart issues or joint problems, you could consider doing high intensity interval training along with resistance training to get the most bang for your buck. And then we have meditation, as I mentioned, for 10 to 15 minutes daily. It is very important to activate the parasympathetic system and decrease cortisol levels. And last but not the least, aim for high quality 7 to 9 hours of sleep daily. Use blackout curtains and white noise machine if you have to, but please sleep well at night daily.
Dilpa, this is amazing because you started off with meditation and we have come full circle and we are going to be parting ways with you ending with meditation. Uh, but before I let you go, this is all the advice that you're giving people. If I was a fly on the wall in your kitchen, right, and I was observing what Dr. Saurabh and his beautiful family does, are there some things that you could share with us? Like when you go to the supermarket, what is it that you buy or you throw into your shopping cart, or any water filter that you use, or anything that you can share with us that will give us an edge in taking care of our health?
Sure. So I start my day with a high fiber, protein, and healthy fat breakfast. That means, either multigrain bread or, it could be whole grain prantha and eggs and healthy oils like olive oil and ghee. Second would be I regularly include fermented foods in my diet. That means dahi and yogurt. A lot of times I would add turmeric in those. Third would be I practice intermittent fasting to give my gut system a rest. And I practice a mild form of intermittent fasting that is 12-12. So 12 hours of eating window and 12 hours of complete gut rest. And basically, what that means is eat early dinner. Be done by 7 p.m. if you plan to sleep around 11. So that would give 11 to 12 hours of um, time for your gut to reset.
Doctor, you've given us such awesome tips. I mean, I could go on for hours, but you need your 7 to 9 hours of beauty sleep.
Exactly.
Um, uh, if if you were not a doctor in this life, okay, I always ask all my podcast guests, if you were not a doctor in this podcast life, what would be your other avatar on this planet?
Yeah, I would probably be doing something similar, where I could be of use to the masses. I could be a nutritionist, I could be a physical therapist, but I would somehow be involved in health, wellness, or medical field because I like to assist people. I like to have an impact on their health and on their life.
Everyone, this is Dr. Saurabh Sethi. I'm going to be putting the link in the descriptor. to where you can find him on social media. He practices in the Bay Area. He's a very busy doctor. He's booked out months in advance. But if you want more tips, then all you have to do is follow Dr. Saurabh Sethi on his channel, and he'll slip in that turmeric with curd and his peppermint tea that he does every now and then. Dr. Saurabh, it's been a pleasure interviewing you today, and thank you so much for the service that you extend to all of us on the planet.
Thank you, Ryan. Likewise, I had a blast, and I look forward to more of these in the future.
Awesome. Thank you for watching this far. It's been an amazing episode, and I'm so grateful to have you till the end. If you like this video, please share this video with your loved ones. Better still, gift me a subscribe, a like, or even a comment, and we'll come back to you.